Welcome back to Las Vegas Now. Intermountain Healthcare, the sponsors of this next segment, wants to remind adults, especially our elderly, that vaccines are not just for kids. So we spoke to a doctor to learn more.
Hi, my name is Sunita Kalra. I'm a family physician for Intermountain Healthcare. Today we're at our Green Valley My Generation clinic, and what we do here is we help take care of our adults and senior population. Today we're going to talk about why vaccines are important not only for our children but for adults in general. There are some conditions that we need to revaccinate for or vaccinate originally for because as we get older our conditions and our diseases change. And everything is sounding very good today. There are 4 suggested vaccines adults should stay up to date on: pneumococcal, hepatitis B, zoster, and influenza. Let's start with the pneumococcal vaccine. A new pneumococcal vaccine has been released for people age 65 and older who haven't been vaccinated or under 65 and immune compromised or with a chronic condition that puts them at risk of pneumonia, such as asthma and smoking. The pneumococcal vaccine can prevent some cases of pneumonia, meningitis, and sepsis. I strongly recommend pneumococcal vaccine, especially in our environment because of the strong changes in our temperature, including dust, winds, and all the allergens in the air. Now let's move on to hepatitis B. Hepatitis B vaccine is recommended for all adults just like it is for all kids. This vaccine protects against liver cancer and liver disease. 2/3 of those who get hepatitis B don't have a known risk factor for it, but it can develop a serious infection if not protected. The Zoster shingles vaccine is recommended for people 50 years and older. Shingles is a viral infection that causes a painful rash. Anyone who has had chickenpox may develop shingles. If you have certain health conditions that make you immune compromised, it may be recommended starting at the age of 19. And of course, the influenza vaccine. The seasonal influenza vaccine is recommended to everyone age 6 months and older, and it generally starts early fall. Some people feel that if they got the influenza vaccine once, they don't have to get it again, but it is very important to get it every year, for the virus can change. And besides those 4 very important vaccines, we still need to keep COVID in mind. New versions of this vaccine are coming soon. A recombinant protein vaccine by Novavax may be available for those who haven't been vaccinated yet. And for those who have been vaccinated, boosters targeting more recent variants are being studied. And just a reminder, many vaccines are covered by your health insurance. Here at Intermountain Healthcare, we're happy to set up a preventative visit to help you decide which vaccines are good for you.
Thank you to Intermountain Healthcare for sponsoring that segment. For more, just head to intermountainhealthcare.org/Nevada. We'll be